This recorded lecture will be going over Chapter 17, Infection Prevention and Control in the Hospital and Home. The infectious process has 4 stages: the incubation period, the prodromal period, the illness period, and the convalescent period. The incubation period begins when the organism first enters the body and lasts until the onset of symptoms. In many viral diseases, the virus is transmitted during the incubation period. The prodromal period is the short time from the onset of vague, nonspecific symptoms to the beginning of the specific symptoms of infection. The patient may experience malaise or a general feeling of discomfort or illness. It is during this stage the patients are the most contagious because microorganisms are most likely to be spread during this highly infectious stage. During the illness period, localized and systemic signs and symptoms appear. Other specific signs of infection may be detected, such as a rash, swollen lymph nodes, leukocytosis, purulent wound exudate, diarrhea, and vomiting. The severity of the symptoms and the duration of the illness will depend on the virulence of the pathogen and the person's susceptibility to that microorganism. People perceive that they are ill, and they may seek professional care. The convalescent period begins when the symptoms begin to subside, and it extends until the patient has returned to a normal state of health. This can take days to weeks, depending on the microorganism and the person's overall state of health. Patient education by the nurse must emphasize the importance of finishing the medication used to treat the infection, especially during this phase. Infections transmitted to a person while receiving healthcare services are called healthcare-associated infections. Many invasive procedures will predispose patients to infection, either due to the integrity of the skin or mucous membranes being altered, or because an illness reduces the body's ability to defend itself against invading microorganisms. Device-associated infections include central line-associated bloodstream infections, known as CLABSIs, catheter-associated urinary tract infections, known as CAUTIs, and ventilator-associated pneumonia, known as VAP. If medical devices are not inserted using aseptic technique or appropriately maintained, the likelihood of a device-associated infection increases. Healthcare providers can decrease the incidence of VAP by elevating the head of the bed of the patient between 30 and 45 degrees, unless contraindicated. Providing a daily sedation vacation to assess the patient's ability to breathe independently, and allowing mechanical ventilation to be discontinued as soon as possible. Prophylaxis to prevent peptic ulcer disease. Prophylaxis to prevent deep vein thrombosis. And daily oral care using chlorhexidine, an antimicrobial oral rinse. The IHI suggests using a ventilator bundle checklist to decrease the incidence of VAP among patients in the ICU. Infection prevention and control involves observing patients for signs of infection, recognizing individuals with high potential for infection, and then implementing the appropriate precautions. Implementing procedures to contain microorganisms when an infection is suspected or confirmed. Monitoring diagnostic reports related to infection, using approved sanitation methods, and properly handling and sterilizing or disposing of contaminated items and equipment. The infection preventionist receives a report from the laboratory every time a culture is positive for a pathogenic microorganism. A report may also be sent to the IP from the nursing unit whenever a patient is identified as having an infectious disease or local infection. Isolation techniques will have initially focused on hospitalized patients, but the evolution of human immunodeficiency virus, hepatitis strains, Ebola, and a variety of drug-resistant bacteria has broadened the focus to infectious diseases. Infection prevention and control practices are focused on protecting patients, healthcare workers, family members, and social contacts in all settings. Infection prevention and control relies on medical and surgical asepsis, standard precautions, and transmission-based precautions to prevent or control the spread of microorganisms. Isolation is a means of preventing the contact between a patient and others to prevent the spread of infection. Emphasis is placed on containing microorganisms and preventing their spread. Two premises underlie the current system of isolation. One is that the infection may be present before the diagnosis is made. The second is that the greatest risk of transmitting infection for most microorganisms comes from direct contact by caregivers' hands or equipment and supplies that have been soiled by blood, body fluids, and other potentially infectious materials. Current standards consist of two tiers developed by the Healthcare Infection Control Practices Advisory Committee of the CDC. Tier 1 is standard precautions and Tier 2 is transmission-based precautions. Standard precautions delineate methods for avoiding direct contact with all body secretions except sweat, whether or not visible blood is present. Transmission-based precautions are based on interrupting the mode of transmission by identifying the specific secretions, body fluids, tissues, or excretions that might be infective. Whether used singly or in combination, they are always used in addition to standard precautions. CDC guidelines state that if full personal protective equipment is required, it should be donned in the following order: the gown, followed by the mask or respirator, and then the goggles or face shield, finally the gloves. The sequence for removing PPE is gloves, followed by face shield or goggles, and then gown, and finally mask or respirator. Always perform hand hygiene after removing gloves or any combination of PPE. When the patient has a known or suspected airborne infection, such as pulmonary tuberculosis, you must wear a special particulate filter mask called an N95. Never touch with bare hands anything that contains fluids from a body surface or cavity. Wear gloves for all contact with body fluids of any sort, including blood, saliva, urine, and feces. The only time gloves are not worn is for contact with intact skin or unsoiled articles. Another precaution is to wear impermeable gowns when clothing may become soiled with bodily substances while providing patient care. Wear masks when contact with respiratory droplet secretions is anticipated, such as during oral suctioning. Add protective eyewear whenever there is the possibility of splashing body fluids. Dispose of all sharps and puncture-resistant containers located in the patient's room. A baseline assessment should include assessing for signs of infection that may require transmission-based precautions. Assess wounds every shift for signs of infection and alert the primary care provider if any infection is suspected. If the patient is frequently voiding small amounts of urine, is experiencing pain on urination, or has a decrease in overall urine output, this could indicate an infection. If cultures were performed on any body fluids, check the reports to see if any microorganisms have been identified. Check the patient's temperature because a fever is usually indicative of an infection. Patients with compromised immune status are often placed in protective isolation to reduce the exposure to infectious organisms. People providing care for these individuals must wear gowns, gloves, masks, and the patient must be in a private room. Donning and doffing PPE can be time-consuming, so it's important for the nurse to plan. Speaking to the patient in advance via the intercom can help ensure that you have everything necessary before you don your PPE and enter the patient's room. Teach a patient who has a potential for infection about the disease process, modes of transmission, and precautions necessary to prevent the spread of infection. Explain standard precautions and transmission-based precautions to any visitors. Use standard precautions for each contact with every patient. Always perform hand hygiene after touching the patient or anything in the patient's room. Before collecting body fluid or other potentially infectious material, verify the primary care provider's order and complete the correct laboratory requisition form. Next, label the specimen container with the patient's name and medical record number. Place the label on the container itself, not on the lid, because once the lid is removed in the laboratory, the specimen would be unlabeled. Place the secured laboratory specimen container in a plastic specimen bag and close the bag lock seal. Both OSHA and the Clinical Laboratory Improvement Amendments require that specimens be transported to the lab in a plastic bag marked biohazard. Soiled linen is handled as little as possible. Roll it up and place it inside the linen hamper in the patient's room. Never carry unbagged soiled linens in the hallway because doing so will increase the risk of contaminating the surrounding environment. Place disposable soiled equipment and supplies inside a plastic bag lining the waste receptacle in the patient's room. If an item were squeezed, slung, flung, or flicked, like a soiled dressing, it could release blood or body fluids, and all of those items should go in a red biohazard bag. Needles are not to be recapped before disposal. Drop all used needles, scalpel blades, IV cannulas, suture needles, and other sharp items into a puncture-resistant sharps biohazard container. Never put your fingers or hands inside the opening of the sharps container. You should replace all sharps containers when they are 2/3 full. Clean reusable equipment if it is visibly soiled, and then send it to the central processing department to be disinfected. Protect intact skin and mucous membranes. Promote a balanced diet and sufficient fluids. Provide opportunities for adequate sleep and rest, and decrease stress as much as possible to enhance your patient's and your own natural body defenses. Place a patient in need of a transmission-based precautions in a private room. An exception can be made if another patient has the same type of infection, then they can be roomed together. Avoid transporting the isolation patient unless necessary. If transporting is unavoidable, give the patient a standard mask to wear while outside of the room. The emphasis in the home environment is on containing pathogens and preventing the transmission to healthcare personnel, caregivers, and others in the household. When the patient has an infection, keep their towels, sheets, and clothes away from others until they can be washed. Washing in warm water with standard laundry detergent is usually sufficient. Dry items thoroughly before use. Launder significantly contaminated clothing or linens separately from other household laundry. Instruct other family members to perform hand hygiene frequently. Dispose of soiled dressings and wound care supplies in plain, unlabeled plastic bags that are tied securely and stored in an appropriate trash receptacle for pickup with the rest of the household trash. A heavy plastic jug, like an empty bleach bottle, with a secure top can be used to contain needles, syringes, and other sharp objects used in the patient's care. Disposal of the jug is subject to local regulations in the city, county, or province where the patient lives. Use clean gloves for wound care unless there is an order for sterile dressing changes. Emphasize to wash the hands before putting on gloves, and then again after the gloves are discarded. Reinforce that gloves should never be reused. The patient's room should be cleaned frequently with dust kept to a minimum. Allow fresh air to circulate within the room. Keep any clean supplies in one area, well away from any contaminated items or trash. For a significantly immunocompromised patient, such as a bone marrow transplant recipient, it is important to protect them from exposure to potential pathogens. Do not allow anyone with an active infection, including healthcare workers, in the patient's room. The patient with transmission-based precautions has a potential for both decreased self-esteem and sensory deprivation. Assessment for assessment for sensory deprivation needs to be ongoing. The signs can include boredom, slowness of thought, disorganized thoughts, excessive sleeping during the day, anxiety, hallucinations, or panic attacks. Having visitors can be helpful in preventing sensory deprivation. The nurse should learn about the patient's interests and provide appropriate activities like games, books, puzzles, or crafts. The nurse can also suggest connecting to the hospital's Wi-Fi, using a patient's smartphone or tablet to listen to music, or using their laptop to watch TV or a movie. Listen to your patient's feelings. Make positive comments on grooming and activity efforts. Try to engage the patient in meaningful conversation by asking about their interests or hobbies. There are three main modes of occupational exposure to bloodborne pathogens. These include puncture wounds from contaminated needles or other sharps, skin contact, allowing body fluids, blood, and other potentially infectious materials to enter through damaged or broken skin, and mucous membrane contact, allowing infectious materials to enter through the mucous membranes of the eyes, mouth, and nose. Actions that decrease the nurse's risk of infection include frequent hand hygiene and other general medical aseptic techniques, like wearing PPE, using needleless IV equipment and needles with guards, and avoiding carelessness in the clinical area. It is also recommended that healthcare workers be immunized if they do not have an active immunity to certain diseases. Surgical asepsis is another method used to prevent infection. Surgical asepsis is practiced in the operating room, obstetric areas, and special diagnostic areas, and for procedures like administering injections, changing wound dressings, performing urinary catheterization, and administering IV therapy. The four rules of surgical asepsis are to know what is sterile, know what is not sterile, separate the sterile from the unsterile, and remedy any contamination immediately. The goal in surgical asepsis is to keep an area free of microorganisms. By being constantly sensitive as to what is sterile, what is clean, and what becomes contaminated, you can catch and rectify breaks in sterile technique before microorganisms are transferred to the patient. The surgical scrub is more lengthy and vigorous compared with normal hand washing. Water, a nail stick, an antiseptic agent, a scrub brush or sponge pad, and friction are used to cleanse the hands and forearms mechanically. The scrub begins at the tips of the fingers, working up the hands and ending 2 inches above the elbows. A 2 to 4 minute scrub is average. Check your manufacturer's directions for the correct technique. Many sterile supplies are prepared commercially and are disposable for one-time use. The package set or kit will provide all items commonly required in a variety of nursing procedures, such as catheterization, suture removal, dressing change, and irrigation. Packs and kits are opened by removing the outer plastic or paper covering, taking out the inner package, and aseptically unfolding the wrapper to form a sterile field. The principles to observe when opening sterile packages include performing hand hygiene, opening the sterile package away from the body, touching only the outside of the wrapper. Do not ever reach across the sterile field. Instead, go around the sterile field if necessary to reach the other side. Always face your sterile field, even when moving to the other side. Allow sufficient space between the body and the sterile field. Most sterile items are available as individually wrapped or separate items. Instructions will often appear on the outside of the packaging, directing you where to open it, indicating the direction in which to tear, or showing where to peel at a certain point. Always follow these instructions to avoid contaminating the contents. Do not stockpile supplies in the patient's room to avoid costly waste. Sterile gloves should always be used for sterile procedures. Whenever it becomes apparent that a break in surgical asepsis has occurred, you must rectify this error. A scrub is begun again if the hands touch the sink, which is always considered contaminated. Sterile gloves must be discarded and new gloves donned whenever any part of a glove touches a non-sterile area or item. It is up to every nurse to point out breaks in sterile technique that occur when others seem unaware that they have contaminated themselves or the sterile field. If the patient is recovering without additional instances of infection from other organisms or infection of other body areas with a resident organism, then the goals are being met. Infection prevention and control measures are the responsibility of every nurse. The principles and techniques learned here will protect you and your patients from harmful microorganisms.